Yes, due to some technical issues that we have stopped our video in the middle only. So, we are starting the new video about the unconscious patients. Okay, let's start. Yes. So, dear students, tell me what are the articles that we can use for the oral care in unconscious patient, rather than telling that brush, leave the brush and tell me other things. Very good. Artery forceps, so much knowledgeable. Artery forceps. Yes, next one. Kidney. You will place kidney tray, or else you can say that is basin, right? Next one. Other things, oral what? Oral gloves. Oral gloves will come. Towel. Okay, towel is needed. Next, water. Glass of water. Bowl of water you need actually. Bowl of water and also glass of water also needed. Okay. Yes, next. Mouth suction device. Very good. Mouth suctioning device. Please close the door there. Yes. So, artery forceps, these are your predictions, that these are the 5 articles that you know, isn't it? So let me see what are the articles that we can use. First one is artery forceps, isn't it? Artery forceps, tongue blade or tongue depressor, you can say. Tongue depressor, that is disposable tongue depressor you can use. And kidney basin, sometimes two kidney basins are needed. And feeding cup is needed only if you want to gargle, if the patient is called semi-conscious, that time you can give, or else if the patient is conscious, that time you can give the oral cup feeding. Okay, are you understanding? But in the unconscious, you can't able to give the feeding cup there. Okay, so next one is small bowel with that water, and also you should add some solutions. Okay, what are the solutions I will tell. Listen carefully, don't talk. Yes, mouth section, that is anchor section we need to use. And syringes in order to pour the some of the little amount of water, not fully, little amount of water we need to pour, that time we need to use this syringe. Okay, so next one is small rubber sheet to place it under the head. Okay, next one is swab sticks, so 3 to 4 swab sticks you need to take. And gauze piece you need to take, 3 to 4 gauze pieces you need to take. Are you understanding? And another one is water based lubricant oral jelly, that should be preventing the crackles of the lips, for that you need to take. Next, glass of water or a normal saline you need to take in order to soak the gauze piece. Okay, not to pour, in order to soak the gauze piece. Next one is two pairs, not two gloves, it is not 2 gloves, it is 2 pair gloves is needed. And next one is PPE, whatever the gloves, apron and eye shield or else foot cover. So gloves which are needed, that one you can use in this according to the patient condition. If the patient is COVID, that time you should use the PPE. If the patient is highly contagious, that time also you should use the PPE. Are you understanding? So you can see the images, original image. Kidney tray is there, chlorhexidine or normal saline solution you can keep. Okay, and this one is gauze pieces you can see in the small bowel. Okay, and small bowl, and there is a cup of glass of water, and the empty glass. Okay, and tray, and also towel will be there, towel here. Okay, towel, clear. Next, So what are the solutions required for the care? See here we can use n number of solutions. There are some according to the institutionalized based solutions they can use. Some hospitals may use normal saline only, some hospitals they may use Condis solution only. Okay, so there are different solutions will be there, right? So most commonly used for the oral care for unconscious is, you can say, that is normal saline. Okay, and routine care if we want to use, that time you can use most commonly, that is routine care means whenever it is required, that time only you are doing, means that is 0.12% of chlorhexidine. For this you will not dissolve or you will not dilute with any water. Okay, 0.12% of chlorhexidine. This solution is not mixed to any dilute solution, any dilute water. Okay, are you understanding? Yes. So next one is, see here they have mentioned into, because they are not used much. Okay, they are not used much, but here so they will use the hydrogen peroxide 1:8 according to practically in your RGHS practical textbook they mentioned 1:8. In your textbook they have mentioned 1:20, and both are correct. 1:8 you can say, or else 1:20 you can say. Okay, so that means 1:20 means that is around 0.5% strength of that means half strength of hydrogen peroxide. Okay, half strength means 1:20 is half strength. Okay, 1:10 means it is 1 strength, isn't it? 1%, right? Half strength, or else we can say 0.5% of hydrogen peroxide. Condis solution means that is potassium paramanganate, KMNO4, that is Condis solution. This should be in a 1:5000 dilution, 1:5000 dilution. Clear? So very importantly you need to understand these ratios, otherwise it will be like if you write 1:500, then it is so much concentrated solution. This one is so much concentrated. We need dilute solution of KMNO4, that is potassium paramanganate, right? Are you understanding? Next one is soda bicarbonate. You can use it because even though our mouth is full of having the lactic acids, or whenever there is a acidosis, or else we have fruity breath, as like in the diabetic ketoacidosis we will get the fruity breathing. That means acidosis will be there in the mouth. So for that you can use the soda bicarbonate solution if the patient with the diabetic ketoacidosis. After the diabetes, this complication will occur. Okay, so this may reaches more than 600 gram per dl also, sorry, mg per dl also. Which one? That is glucose level. Normally you and I should have 70 to 120 is okay, 70 to 100 is okay, 70 to 140 is also okay, but more than 140 itself diabetic or a pre-diabetic we can call, right? Now understand, the diabetic ketoacidosis is a complication which is having maybe more than 600 or else maybe more than 250 mg per dl. It is complication only, right? Are you understanding? So not only that, other things also there, so which is not sufficient, which is not required in this class. Clear? So now we will get into the, we have understood about the solutions that we can use for the unconscious patient. Now here use the solutions as I said. So according to different institution, like in the Siddhartha it is different, Sridev is different, and in some other institution like Bangalore institutions, hospitals, wherever it is different in their what their using of the solutions. Some of them are using hydrogen peroxide, some of them are using the KMNO4. Okay, so according to their policy they will use it. Clear? Are you understanding? Okay. So now we will do the activity now. So tell me, what is the, after assessing that an unconscious patient has an absence of gag reflex, there is an absence of gag reflex. You know about the gag reflex? What is the meaning of gag reflex? Gag reflex means you should have the stimulation to the pharynx, so that you can get the, you can able to swallow, or else you may able to spit it out. That is what we can say, gag reflex. Or else if it is, if we place the tongue depressor, that should feel like a vomiting. So if it feel like a vomiting, then it is presence of or positive gag reflex. Are you understanding? So it will happen in the semi-conscious and conscious. In the unconscious, it is completely gag reflex is absent. Clear? So what we have to do for the oral care if there is absent? So we will discuss that later. First you first you tell this one. Clear? So after the assessing that an unconscious patient has an absence of gag reflex, what is the nursing priority action? Option A, give the patient a glass of water. Option B, stop the oral care procedure. Option C, ask the patient to rinse the mouth. Option D, place the patient in a side-lying position. What is your answer? Yes? You have 4 options. Which one you feel? Any one of you? Yes, any boys? You can say boys or girls. Yes, Rehan, what do you think? So it's just a try. You can try also. If you know the answer, you can say. What's your opinion? I'm asking opinion, not correct answer, right? You can say the correct answer also. You may say wrong answer also. Which one? So here, so there is an absence of gag reflex. There is an absence of gag reflex means there is a highly chances of what? Aspiration. Okay. Suppose if there is a what, as here the throat is there, and here what it is, this one is the esophagus and this one is what? This one is the trachea. Now you pour the water inside. You pour the water inside. Now this may go this pathway also, or this pathway also, due to the absence of gag reflex, and this epiglottis will never close due to the absence of gag reflex. That time what happens? There is a chances of aspiration. Aspiration means if any content that may be in the mouth or that may be in the gastric content. So those gastric content or a oral content that will goes or that will escapes into the sweeps into the trachea, then we can call that as a what? Aspiration. Are you understanding? Now tell me, due to the aspiration risk, will you give the oral care or not? Will you give the oral care? Actually, oral care is sufficient. Oral care is sufficient. You should not stop the oral care. Oral care is very important because that will cause us the infection. Oral thrush, oral candidiasis and other infections also, right? Are you understanding? Oral ulcers, these infections may occur. So that's why you should not stop the oral hygiene. B option is eliminated. Now tell me which option you can choose. Next. Yes, you can't able to give the glass of water. Why you can't able to give the glass of water? Because there is a chances of aspiration. You can't able to give the glass of water. Then this is also wrong. Then option C and option D. Which one is the right answer? D. So here clearly it is saying the rinse the mouth. Rinse the mouth. Again there is a, he can't able to rinse also. Why? Because he is unconscious, right? So if he was unconscious, where the unconscious, sir? Here it is unconscious, so that you can't able to rinse the mouth also, right? So option D is the right answer. Please keep quiet. Option D is the right answer. So we will see oral care. So now we will come to the procedure steps. In the oral care assessment, first we will do the assessment, next planning, later on implementation, later on evaluation and documentation. First we will do the oral care. See, we need to check with the tongue depressor we need to take, and we need to check the gag reflex. Why we have to check? Because of the identify the risk of aspiration. Next, so if there is any dentures or loose teeth, if it is there, that time also we need to observe and we need to clean it. For that purpose, we need to first and foremost we need to observe what? We need to observe the gag reflex. Clear? Are you understanding? Okay. So next one, we'll get after the this one assessment, we'll get into the planning. So in the planning, what else we can see? So gather all the equipments and also explain the procedure and close the door and pull the curtain. Okay, these are the three important points for the planning. So here in the planning we could see that arrange all the articles as we mentioned, whatever the articles that we mentioned, all the articles you need to gather it in front of the patient. Next one, explain the procedure. Sir, the patient is unconscious, how we can able to hear? Actually, even unconscious means, what is the meaning of unconscious? He can't able to respond. He can't able to respond, but he can sense. He can sense, he can't able to respond. That's it. That means you can give the stimulation, you can say something so that they can understand, but they will never respond. They can't able to respond. That is what we can say, that is in the unconscious patient, right? So explain the procedure even if the patient is unconscious, and stimulation and reassurance is very important. Patient consent is very important. Clear? Informed consent. Next, close the door or pull the curtains. So close, you need to close the door and you need to pull the curtain for the privacy maintenance, and later on you can give the oral care. Okay. Next, so this one, tell me that during oral care the nurse moistens the gauze with the normal saline and squeezes out the excess solution before cleaning the mouth. The most appropriate rationale for this, see what we said before, we should not use the water to pour into the mouth, isn't it? Then how we have to clean, sir? We have to clean with the artery forceps will be there, no? With the artery forceps, we need to wrap the gauze piece here. We need to wrap the gauze piece and we need to dip in the solution. Later on, we need to give the oral care. We need to remove the whatever the debris inside it is there. So like this, we need to give the care. We should not directly pour the water into the mouth. Are you understanding? So dip the artery forceps and clean it. Don't pour the water fully. There is a risk of aspiration. Even though you have poured the water, that should be little. You need to pour. And after pouring little, immediately you should have the Yankor suctioning machine there. So suctioning machine should be there to suction it immediately. For the little amount of water if you pour, not excess amount. Clear? Are you understanding? Okay. So then what is the answer for this one? So we are squeezing the whatever we have dipped, no? So we have dipped the artery forceps with the gauze piece. Now the gauze piece with the excess of water is there, we need to squeeze it in order to prevent from full of water in the mouth when you are doing the care. Okay. So that's why we need to squeeze it, squeeze out the excessive solution before cleaning the mouth. So what is the most appropriate reason for this? That is, what is the answer for that? That is, prevent the aspiration by reducing the excess fluid in the oral cavity. Understood this one? Everyone understood? Okay? Yes. Implementation. So in the implementation, it will be only 10 steps. Okay. So implementation. So in the implementation, what we have to give? We have to give the listen. Okay. We need to side rest, we need to remove only at one side, and we need to head of the bed 30 to 45 degree as we said. Next, sixth one, we need to place the suctioning machine beside the bedside when you are giving the oral care. Next one, as I said, the gauze piece with the artery forceps we need to wrap, and we need to dip into the solution. Okay. Next one, we need to what we have to do, we need to squeeze out excess amount of that whatever the gauze has taken, absorbed that solution, we need to squeeze out it. Clear? In order to prevent the aspiration or else excessive fluid in the mouth, in order to prevent the aspiration, right? Next, we need to gently clean from the everywhere, that is gums, teeth, and also cheeks, right? Inner cheeks, right? Next one, we need to once if we clean, so we need to discard that, and we need to take another gauze piece and we need to dip it and squeeze out, and again do the same procedure, right? Next one, so pour the little amount of water, as I said, pour the little amount of water. So we need to squirting water. Okay, what we have to do? Squirting water. We call it as a squirting the pouring or squirting the water inside the mouth. And lubricant jelly, that may be boroglycerin or that may be Vaseline, that we have to apply in order to prevent the crackles. Next one is, so we need to explain the procedure even if they can't able to respond, we have to say that your procedure is finished, that we have to say. And next one, you need to remove the gloves and dispose in the which one? Dispose in which bin? Which color bin? Red. Okay, red color bin we need to dispose. Next, clean the supplies, whatever the gauze piece, tray and all, if it is there, that one you need to remove. Clear? And next one, so we need to do the evaluation. In the evaluation, again you need to put on the gloves. That's why we said 2 pair of gloves. 1 pair for doing well care and second pair for the evaluation. Are you understanding what you are evaluating? While you giving the care, are you rubbed very roughly or else are you rubbed very gently? So that you need to check now for that ulceration or else any the tooth injury, if it has happened or not, that you need to check in the evaluation. Clear? Okay. In the last, we need to document it, date and time, what is the type of the care, that is oral care for the unconscious, and which solution we have used, that is hydrogen peroxide, what is the condition of the lips, whether it is cracked or bleeding, so that one we should say, and the presence of ulcer is there or not after the care, and these points you need to include in the documentation. That's it. Clear? Are you understanding? So these things we have discussed in this class about the oral care for unconscious. So we have made oral care for conscious as a separate video and oral care for unconscious for separate video, right? Understood? So in the bed bath we will discuss in the next class. Thank you for listening the class.